Catherine, I am thrilled to have you here today. Thank you so much for joining. I'm very excited for this conversation, so thank you for being here. My name is Christine Perfetti, and I am the founder of Lift Up Connections, which is a company dedicated to lifting up women who are going through midlife. I have the pleasure of introducing Catherine Norman. Catherine is a licensed professional counselor and holds a Master of Science degree in clinical mental health counseling from Loyola University. Before becoming a counselor, she worked for years, over a decade, as a civilian supporting the U.S. Navy and Marine Corps. She has deployed to Iraq and Afghanistan. So, in addition to talking with us about EMDR and managing midlife and career pivots and all of that, I'll be asking you a little bit. I'm just fascinated with your background. So, Catherine, thank you so much for joining us today.
Thank you.
Another reason why I'm so excited that you're here is that I've gone through a lot of therapy and a lot of therapists in my life and career, primarily cognitive behavioral therapy and talk therapy. We met a little over a year ago. You are my counselor and therapist, and we have used EMDR. I tell probably too many people that you're the best therapist I've ever had by far. So if I can give back to the community and have an opportunity to share your wisdom, all the better. So thank you. So with that, gushing aside now, can you tell us a little bit about your story, Catherine, specifically the story of your life in a minute or two? Really easy, but can you tell us a little bit about yourself?
Yes. So I grew up in California and very much got the desire to want to help people. I didn't quite know how I wanted to do that. I actually came out here and studied international relations, got a degree in international relations, thinking that I might do some work in international development, but that's not where things went because I had more of a desire to sort of understand how things work. As Christine mentioned, I started off more in the STEM field, studying mathematics and doing some modeling and data science, which is what led me into the career for working for a decade with the U.S. Navy and the Marine Corps. Was that I was working there as an analyst with them, trying to help them understand first training exercises and some of the work that they're doing here in the States and also over in Iraq and Afghanistan to try to help them see if they're doing what they wanted to do, helping with assessments and trying to find some ways to help them do their job better. When I got back from that, what I realized was that I really wasn't interested in crunching numbers and writing reports anymore. That was no longer fulfilling. I wanted to do something that was going to have more of an impact on people. And like many of the people that Christine's working with as far as making career pivot, when I realized I would like to be able to work with people one-on-one as a counselor, that required a choice of, okay, so that requires going back to school and getting a master's in counseling and making a real career pivot, which is what I did.
I'm wondering about that point where you hit when you came back to the States and you were thinking, what do I want to be doing next with my career? And where you were considering moving into counseling. I know a lot of people and women, not just in midlife, but thinking about career pivots and thinking about what's next. What was going through your mind and what were your considerations before making this pretty drastic shift in counseling?
I was feeling very burnt out and feeling like I did not want to continue in the job that I was doing for the next 20, 25 years. I'm like, that's not, there are a number of people at the Center for Naval Analysis who do make that their like lifelong career. And I'm realizing I could not do that. I didn't want to do that work anymore. And got this like energy, like I have to do something different because where I am is not sustainable. So I needed to find a way to do something different and something that I cared about more, that meant something to me.
That really resonates. I haven't shared this with you, and I'll share with the audience. There will be a lot of sharing today, I expect. I mentioned to you that I'm running sessions on a weekly basis. And in my life, what I'm known for and my identity is all around product and research and UX. I think about what knowledge and experience I've had over the last few years that I think could be most valuable to folks in the tech community. I run sessions like this, Catherine, where I'll be talking about artificial intelligence and UX research, and 100 people will sign up because in the tech world, everyone's talking about AI. Is that what I think we should be focusing on for the most part? No. In terms of why I'm running this session and hope to run more of these sessions with you, when I think about how I want to give back and contribute to my community, it's having sessions like this. It's a really messy, chaotic time in our world, for many people's worlds. And I think about what could be most beneficial to women in midlife, to technologists. It would be to be hearing about the work you do in EMDR. This is the top item on my list. I'm sharing with people now that I see a therapist and that EMDR has been transformative. And a little secret is some tech people are also having EMDR therapy sessions, and they said, absolutely, it's transformative. So I was hoping you could share with us, what is EMDR?
EMDR stands for eye movement desensitization and reprocessing. It started as a trauma therapy back in the 1980s. The psychologist, she was trying to figure out how to help veterans who had returned from Vietnam and wanted to help them move through their traumatic experiences so they could move on with their lives. And she had the idea that we really process our memories and our thoughts during the rapid eye movement sleep, during that REM sleep. And so she had this idea that if we could stimulate people to actually bring up some of their memories and their feelings and the things that they're re-experiencing or things that they can't let go of, and bring that up at an emotional level. And she thought at first that having stimulating eye movements would be really helpful. That turned out to not be the case. EMDR is slightly misnamed, but the bringing up these emotional memories to desensitize them. So if you've got traumatic experiences and want to lower the intensity of them, because a lot of traumatic experiences can still seem very emotionally alive. And so you can try and desensitize those. Or what's probably more for our topic today is the reprocessing part. We often, whether it's from a traumatic experience or just from childhood and life itself, we often develop narratives about ourselves. And some of those just aren't true as you start to reflect on them. The EMDR gives you the opportunity to reflect on and re-narrate some of that.
You bring up something where it may be some of the hesitancy people have to talk about EMDR, like where you were mentioning we can revisit narratives from the past and see to what degree are these accurate or not to help bring us forward. There is the thought that EMDR is really only if you've had deep trauma. And it sounds like you're working with many clients where it's not about deep-seated trauma. It's about revisiting some of the past narratives.
Some of the past narratives could come where sometimes people think, well, I'm the middle child, and the middle child is always the one that's not loved or cared about as much. You can come up with a narrative, oh, people don't care about me, I don't matter. Or if you had to figure some stuff out as a kid yourself, and then you wind up with this narrative of, oh, I can't ask for help. It's not okay to ask for help. I have to do it on my own, which is great if that's true, and you're a sort of a teenager who's trying to figure out how to get to college and make this happen, and you're not getting much support from your parents, say. So that's true, and it's a great thing, and you get that, hey, I can do it. But then at some point, that narrative of, I have to do this all myself starts to collapse because there's a lot of things going on in life, and it would be great if you could like trust a partner or trust friends to be able to ask for help and to really take that in.
Yeah, that's really helpful. I've been thinking about, it seems like EMDR can be so helpful at various different stages. A couple that are top of mind to me, in the tech sector, things are really uncertain right now for a lot of people. I know a lot of people, my colleagues know a lot of people who are either out of work or they're concerned about their work, or after they've been laid off, they're feeling very unseen. I'll ask you this scenario, Catherine, where when you have a client like that who may be at midlife going through a really tough job transition, not feeling seen, feeling isolated, my thought was that's a period where EMDR could be so helpful. My hypothesis is when people are feeling those feelings of isolation and unseen, they're probably feeling things from their past as well. And I'm wondering, when a client comes to you with that sort of challenge, where do you start? Can you walk us through how EMDR works? Imagining if a client came to you and said, "Hey, I just was laid off. I don't know what's next. I'm feeling like no one sees my value." Where do you start?
That's a great question. And so if you're thinking about identifying what some of the narratives are that may be holding someone back in that situation, because obviously if there's all this churn in the tech industry and people get laid
Mm-hmm.
off, there's a whole bunch of different thoughts people could have in that kind of circumstance. It could be, I'm not good enough because I'm one of the ones who was laid off. If I were better, if I were smarter, then I'd still have my job. And so they feel like they're stupid or they're not good enough. Or a feeling of, why is this happening to me? Because bad things always happen to me.
Yeah.
And I will never succeed. Those two examples are very different stories that the person's telling. And during an intake session, I'd be listening for, how is this new client talking about themselves? What is their narrative? And then it's how can we work to change that? Because changing and getting to a place where people are more self-compassionate can really be helpful for being able to move forward, because you're
Mhm.
not stuck in one of these sort of pain-driven narratives, but you're instead able to, hey, let's work on the situation as it actually is, rather than from all of this pain, which is likely from whatever narratives you got from childhood.
Yeah, thinking about the intake session, and it's been a while, but I'm assuming you've gone through that process so many times with clients that when you're having the intake, when they're saying something about their current feelings, you must just have that radar of, oh, I want to ask about this. There's something from the past here. I'm assuming you're picking up on that pretty immediately in these intake conversations.
Yeah, because that's what I'm looking for, is what are these underlying narratives that the person is telling about themselves? Is it I'm not good enough, or I'm alone, or I have to do things by myself, or um, I'm unworthy? Those kinds of things are these underlying thoughts.
Yep.
And we haven't really talked about what EMDR does. So EMDR therapy compared to talk therapy, because you could
Hmm.
identify those same narratives in your standard cognitive behavioral therapy, talk therapy, and
Yeah.
talk about that at great length. And sometimes talk therapy helps. I shouldn't knock cognitive behavioral therapy completely, because the idea is that if you can recognize what some of these thoughts are, and these thoughts that I'm saying, these are thoughts. I'm not good enough, that's a thought. And you can try and change that by saying, hey, I actually do very good work. Hey, I have this amazing resume. I have all these accomplishments. So it's not true that I'm not good enough. And that may be able to think, changing your thinking may help
Hmm.
you to change your behaviors. Or maybe you start to change your behavior by increasing your job search and like doing more and getting more active, talking to people more. And that might, and it's often does, but that may then change how you feel. That's
Hmm.
that's the basic idea of the cognitive behavioral therapy, is if you change the way you think and you start taking some different actions, you're going to feel better.
Yep. Yep.
And so that often helps and it often works. But sometimes with the talk therapy, you can avoid some of the emotions. You can talk your way, you can rationalize your way so that you avoid talking about what's really where the real emotional pain is. And so you don't talk about that with a therapist, and it just stays, and then you wind up stuck in talk therapy. And that's where EMDR can be so powerful, is because we identify some core memories that are associated with whatever the thought is. If I'm not good enough, let's talk about a time as a kid. Maybe it's in elementary school, maybe it's in high school, where you have this core memory of not feeling good enough. And we talk a bit about that memory, and then I let the client start to think
Mhm.
about that for maybe 20, 30 seconds. And then I stop them and ask, what did they know? What did you notice while you were thinking about it? And then that gives the client an opportunity to talk a little bit. And then I let them think some more. Again, 20, 30 seconds. That process is obviously very different from talk therapy, but it really allows people to get into their feelings and these memories and into the emotional level that sometimes the CBT never reaches.
Yeah, as you were walking through the approach, Catherine, I was thinking about the EMDR approach and reading the book, The Body Knows the Score. I recall many times in sessions, and I'm sure you get this with clients, they're talking about some of their problems and feelings of the day. And you'll ask, where are you feeling this? And I could say, oh, in my head or in my chest. And then what's really fascinating, when you ask that question, and then we move on to, when did you feel that before? It's not necessarily the thoughts in my mind, but like, when have you felt those sensations? I found that's a really productive way where some of the past narratives that have come up,
Mhm.
I hadn't thought of ever during my
Right?
years of talk therapy, but you really honing in on, where are you feeling this? And can
Yeah.
you now recall another time you felt it? It's really fascinating that it is about where you're feeling the sensation in your body. And that's what's coming up quite a bit. It's all those emotions.
The Body Keeps a Score. It's a great book, and it is really amazing that people will hold on to different emotions in different spots. Like sometimes people will have these memories of whether it's maybe not feeling good enough and that stress that might be in their shoulders, but then
Mhm.
when they're thinking about, hey, I don't feel safe to ask for help, and that's maybe down on their back or in their chest or somewhere different. Like people hold
Mhm.
on to these different feelings in different parts of the body.
I know you run both day-long intensives for EMDR, but you also run shorter sessions. And I'm wondering if there's a way, just so people have a sense of how these sessions work and how they're different from a typical talk therapy session. Can we just briefly walk through what the stages are? Like, I'm thinking about, and I've gone through the intake meeting, and I've also gone through the periods where I'm talking a lot about what's going on today and the feelings. And then once we pinpoint the feelings and a client comes back to you with some of those old
Mhm.
memories and narratives, can you walk us through what the steps are of an EMDR session and what's happening at each of those stages?
Once we have a plan of what the beliefs or narratives are that we want to work on reprocessing, then it's finding what some of the core memories are that are associated with that. And sometimes those are in childhood, and sometimes those are more recent memories. I often will go back and forth between doing childhood work and then doing things that are more recent, because in order to fully change one of these narratives, you really need to be looking, in the past, in the present, the recent past, and then also looking toward the future of how are you going to do things differently in the future.
Mm-hmm.
But back to your question of how did the session go? Well, we've identified then what the target memory is to launch this effort at changing one of these narratives. I have the person think about what this memory is, and we talk about it just a little bit. And then I ask, what's the most disturbing piece of that? It hones in on, why is this still bothering you, right? Because you can talk at great length about whatever, I don't know, let's pick first day of high school, and something like terrible happens as you arrive at high school and your friends aren't there to help you, and it was just terrible. And why does it still bother you? Because if you'd been able to let go of it before now, you would have. So that we talk about then, like, why is it still bothering you? And then it's the question to confirm what the narrative is that we're addressing. And I ask people to rate how much this still bothers them and how they feel about it. And then, as you were saying, Christine, to notice where these feelings are in the body. And then at that point is where we would launch into, let's let this memory play out like a movie and just recall what happened there during stuff at school or stuff, arguments at home or whatever it is. And then that's where we would be alternating between letting the client think about that for that sort of 20, 30 seconds, and then talking just a little bit about it, which is really the heart of the EMDR, is that back and forth between thinking on your own and then having to turn the prefrontal cortex back on to talk about it. Really lets you go back and forth between reflecting on it from today's perspective and feeling it at the time. That dual perspective is a really big part of the healing that the EMDR can do.
It's so helpful. And when I was promoting and telling people I was having this session, I was talking about, we all know sometimes when we're revisiting old patterns and behaviors, but as we become more conscious, it may be noticeable. You mentioned something as you were going through we talked at the beginning about this is EMDR for eye movement
Yes.
desensitization. And you said the eye movement may or may not be part of what's happening. In our sessions, when we're back in the past, we'll do some tapping, shoulder, left, right tapping. Why are we doing that?
The either the eye movements, which therapists do often still use eye movements if they're doing sessions in person in particular. They may move their hand back and forth and have the client watch the hand. That was the standard way that EMDR was first done. The thing is, it's not necessarily the eye movements, but having some sort of, they call it bilateral stimulation, where you're moving back and forth, whether it's the eye movements, whether it's tapping. Some people use sounds. They'll have the clients wearing headphones, and so there'll be a sound coming on the left and right. And so there's various ways. Even you can do eye movements over a video screen as well. I tend to not do that because I like to avoid extra sort of technological glitches that can happen. But having this bilateral stimulation gives first a sense of motion, which especially for memories and feelings and these core beliefs that are very stuck, I think that motion is helpful. It's also a sense of grounding here in the present, that if you're looking back at memories that you find really difficult or that are really emotional, that this gives you a grounding to, even while you're not talking and interacting with a therapist in the present, there is still this motion and touch or the eye movements that is grounding you to the present. And that's, again, this like dual focus, right? I was talking about how going back and forth between talking and thinking gives you this dual perspective, but there's also whatever the bilateral stimulation is, and then your own thinking provides also another way to get that dual focus.
Yep, absolutely. My perspective on the client side of things, I really appreciate the benefits that you were describing, that it's grounding a bit and grounding in the present again. What I've found eye-opening and mind-blowing from the whole experience, and what I've thought is the biggest value, I think there's a lot of benefit. You talked about when you go back to your past story, and there's the period where you're feeling the story and feeling those sensations, and you'd ask, what about this is still bothering you? You also have asked, which I found mind-blowing, what else was going on around that time where you think about things outside of that particular memory, but the context and what was happening with your friends or family. What's been eye-opening, sometimes when I'm talking about something in the present, there's many things that are similar about that past feeling that are outside of that one moment in time, where it gives me a sense of, oh, when something's happening in the current time, and I see so much of it is similar to what happened in the past, it actually gives me a sense of peace. This is happening now, but my reaction to what's happening is very much tied to what happened in the past, and it does help ground me in the present. I'm curious, is that part of EMDR, or is it your approach to combining talk and EMDR where you're asking clients, like, what else is happening around this time in the past? I found it so enlightening.
That's one of the things that the EMDR therapy, by focusing here on these memories and the emotions that you had at the time, is that those emotions associated with both with a traumatic memory or just a highly emotional childhood memory, is that they get crystallized. and they then get stored as a package.
Mhm.
And so you take a memory from, just to pick a random age, you're an 8-year-old, and the 8-year-old's perspective on what's going on at that time is very much like child focused, because hey, kids see the world from their perspective, looking outward with them as the center of the world. They're looking up at their parents and thinking, hey, my parents are adults and they know everything, and they may be saying things that don't make sense, but they're the grown-ups and I'm just a kid. I have to now reconcile this, versus when you can look back with that bigger picture and say, let's look with this dual perspective. Look back on that from today. What else was going on? Or look back on that from today and think about, maybe your parents didn't know everything because they're just like humans, right? Especially, this is a great thing for doing EMDR in midlife. You may be about the age your parents were, so you can look back and be like, oh, okay, so maybe my parents didn't know everything.
Oh, no, no,
Because
Catherine,
I'm
I
just
know
talking because I was
everything
8.
now.
You know everything now.
I do. Once you hit midlife, yeah, no flaws. No, that makes a lot of sense. Seeing that your parents were very much human too.
Right.
Absolutely. I give you a scenario that was a little bit doom and gloom around the tech sector right now and people having a rough time there. I've heard a much more common scenario. I'm a woman in tech, I'm a woman in product, I'm also a woman in midlife. So I know a lot of people who fit
Right.
that background and demographic. I've been meeting and known a bunch of, the only way to describe them are powerhouse women in the tech and product world who are doing well, whatever we mean by well, doing well in their career, but getting to the point where they're asking themselves, is there something else? And what is next? And going through this period of thinking about what will come in the next chapter. When people are thinking about, oh, my career's been okay for me, my life has been going okay, but I'm not really feeling like this is my path for the rest of my life. Where does EMDR come into play for something like that, where it's not like anything is wrong per se, but it's people revisiting where they are today and is it what they really wanted? You were even talking about when you came back from your service, hitting that point. How does EMDR help then for those powerhouse folks trying to figure out what's next? Or does it?
It can. That's a piece where sometimes if people are struggling, you frame it as this dilemma of what to do next, what matters.
And this
Uh,
isn't on my mind at all, Catherine, obviously.
right. EMDR is often associated with, this is about recovering from trauma, or maybe not necessarily that you had to have had a traumatic experience, but you've got these narratives from childhood that you want to rewrite. But EMDR can also be used as a way to help people think about what's either really bothering them right now, because often people will have ruminating thoughts, especially people who get the ruminating thoughts before bedtime, and they can get very stuck because you keep thinking the same things over and over again about, hey, my career isn't where I want it to be, my life isn't where I want it to be. I wish I had this, I wish I'd made this choice, and thinking about, if only I had done this graduate program earlier, then I would be in better shape. And those ruminating thoughts can get stuck. I've even had people just let their thoughts start that ruminating process like it normally does as they're trying to fall asleep. Then I break it, because that's what the EMDR, having the therapist there, says, I'm going to let you ruminate for 30 seconds, which is not a lot of time, but people are spending a lot of time unable to sleep because they're worrying about what to do next. So you ruminate for 30 seconds. Hey, what did you notice? What was going on? And you have to talk about it. It breaks the pattern, right? And it allows people to get to a place where they might realize, I've been thinking I can't change careers because financially I can't afford it, versus when they actually do this kind of process where I break that normal thought pattern, then they may come up with something else. Like, I can't make this leap because I'm feeling like I'm not good enough, or my skills are too outdated, or I'm feeling like my real problem is that family-wise, I'm not where I want to be. And then people have been obsessing on the work questions to avoid other issues. And so then you can wind up in a very different spot.
This notion of taking a career pivot, especially for people who have felt quite successful in their approach so far. One of the most common reasons I hear from people that they're not making the shift is my responsibilities to myself, my family, and it's just easier to continue on because we're breadwinners and we support our
Right.
family. And there is something really to that. You mentioned oftentimes other things come up that it's easy to leap to the responsibility you have to your family versus what else might be going on there with
Exactly.
them.
Yes,
Okay.
that's very common, that whatever that fear of not being able to make a shift because, hey, you're in such this position that's where you're getting a lot of, you're being financially well rewarded
Mhm.
for it. And so you'd like to make a career pivot to something else, but it may not pay as well. That's a very valid issue. And then if you can get stuck on that
Yep.
versus there may be other options here. Some of what I do with the therapy, whether it's talk therapy or EMDR, is just trying to think about options. Maybe you can't make a career pivot right now because your kids are about to start college and losing your income right now is not the right choice. Maybe you can think about doing some volunteer work. Maybe you can start looking into whether it's graduate school programs or other kinds of career options for retirement or for early retirement types of options. And it's thinking about other options that may not just be do current job or take this other job at $30,000 a year, right? Those are not
Yeah.
the only two options out there.
Yeah, absolutely. And this may not be the case, but some of the patterns I've been seeing, some of me branching out into new directions while not just saying goodbye, product career, UX career, but branching out a bit is running these small groups with women in midlife who are trying to decide what their next act is. One theme that's come up from many of the women right now who are saying, okay, I'm making a pivot, I'm all in, they oftentimes perceive that they've hit this unsustainable point. They're feeling like this doesn't work anymore. A lot of people in their tech career who are quite successful from an outside abundance perspective, from a revenue perspective, it is working. And that's where I'm seeing a difference. The people who are coming to me saying, yeah, I'm ready for a pivot versus the people who are not, eh, in general, are feeling a lot of pain. I've been wondering, is there a notion that you have to have hit this pain point or rock bottom to be able to make a massive inflection point? But maybe you have clients where that's not the case.
No, my sample is skewed, of course, because I'm seeing
Yeah.
people who are coming to therapy. You come to therapy also because things are not going well. If you're doing well enough on your own, you wouldn't be coming to therapy. But I think coming to that point where recognizing this is unsustainable, feeling a lot of pain, feeling a lot of hurt, and that's where you recognize that something has to change.
Mhm.
But the question is, what options are out there? Or even like recognizing that there are options, because it's so easy to get stuck in the all or nothing thinking that it has to be all one way or the other. As I said, it's the I'm either going to stay at this high revenue job or I'm going to work with disabled children. Like I'm going to go work in like a special needs preschool kind of thing and earn
Yeah.
minimal money.
Yeah.
Okay, those aren't your only options. There's other ways to think about what could you do for caring for kids or for working with whatever issue, really climate change. Like what can you do to actually find some part in that would be helpful? It doesn't have to be quitting your job or staying miserable for the rest of your life,
Yeah.
right? That there are other options out there. But it's a big mindset shift, is to get out of that all or nothing thinking and recognize that there are a lot of options out there.
Yeah, absolutely. We've spoken to this a lot that EMDR can be really helpful at helping people see their narratives and patterns over time. I'd love to get your take on group work, whether there's like group therapy you use as well, because when I think about EMDR, before I tried it, I could look at other people in their lives, and I'd be like, oh, that's the same pattern, or that's the same
Right.
pattern, or and I was very good at detecting what I thought were other people's patterns and habits, and not so good at being conscious of mine. So EMDR really helped with that. I'm also finding with these women in my group sessions, just being part of a group can help remove blockers and blinders. And I'm curious what your perspective on that is. I've mentioned to you, I'll bring 5 to 6 women together and they'll talk through their mindsets. Do you do the same for your work at all? I'm assuming it's not an EMDR session, but do you advocate and are you a proponent for group sessions with people as well? And if so, how do you use that approach?
I'm not doing any group work now. I did for a while work at a substance abuse treatment program, and that was mostly group work because a lot of that kind of recovery is helping people recognize that they're not alone. And that's precisely what the group work allows, is for people to hear each other's stories and to both learn from each other, but also just come away from that appreciation that you're not the only person in the world who's feeling that way. And I think that's where your work there, Christine, with bringing together women in midlife, is that people can get very isolated, very siloed in their work and their family, their children, and not have much time to get together with friends or to network. And so we wind up feeling very alone. COVID was horrible for that, since it absolutely made us isolate. And so we're still coming out of that and trying to realize that a lot of us are having shared experiences. So yes, I think group work is very important.
One of my biggest takeaways just seeing the women is, yeah, this notion of being alone and isolated, even just the reassurance and validation the women get from each other that, oh, it isn't just me. When you have a level of intimacy with people, you share more. And I've seen from a lot of people, it's been a hard period for a lot of people, but you don't see all of that on the exterior of others. So having that opportunity just to see, oh, it's validating, it's not just me, can be really helpful. It sounds like you've seen the same.
Yes, absolutely. People out there on social media only post what's going well. And so you
Yeah.
think, oh, everyone else is doing so well. I'm the only one who's suffering. That's because they're not posting. They're not
Yeah.
posting the suffering part.
I have one final question for you, because back to the women on the councils I'm working with, for those women who are thinking about what might be next, as you mentioned, it doesn't have to be, I'm staying in my life in tech or leaving it completely. When you were thinking about your pivot and when you work with clients, what considerations do you encourage your clients to think about? And what did you think about before the major leap?
To answer for myself first, I definitely felt I was in a place that was unsustainable. And I really needed to do something that I was going to find interesting and meaningful. And as I was thinking about, okay, so pivoting to being a professional counselor, it's going to take a lot of time, both going to school, and then there's this whole internship, and you have to be resident in counseling for a while before you can actually be a counselor in private practice. And that's going to take a lot of time, right? And it's, oh my gosh, can I do that at this point in my life? And I'm getting older and I don't know if this is the right choice. And something that I read was, let's say your degree program is going to take 3 years to do part-time while you're still working. And so then say, well, how old are you going to be in 3 years' time? And I guess how old, like students, sorry, got it backwards. How old are you going to be when you finish that degree program? And then the question is, how old are you going to be in that 3 years' time if you don't get the degree? You're going to be the same age, right? You're going to be 45 or 50 or 55 in 3 years' time anyway. And so the question is, do you want to start down that path toward making a change or not? And that was something that I was like, hey, you know what? I need to do this, and I'm not too old to do it, because that was really part of my big dilemma, was like, wow, the future is pretty bleak if I stay where I am for the rest of my career, precisely because it's still so long. I'm not nearing retirement. I've got a lot of career left. I guess I would say to people as they're wondering, can they make a pivot? Can you start down a path part-time? Can you start down a path of change, even if it's going to take a long time? So you're going to be getting older regardless of whether you start down that path or not.
Yeah. This really speaks to me and resonates with me, especially for women in midlife. There's this notion that society oftentimes starts communicating a message to women in midlife. Thank you very much. Bye
Right.
bye. I think part of the challenge, and I've been working with women in the councils to think about this, the message you're getting from society is also not a true narrative. Like the mindset shift. I shared a story on LinkedIn where my son said to me 3 years ago, how come my life changes all the time, but yours stays exactly the same? And he was not exactly, but there was an element of truth. And it was partially the only thing I could say is I was picking up on that narrative, like, oh, I'm in my late 40s, time to start wrapping it up. I actually described to my son that I will have a little old lady house soon. And he snapped me out of it. To your point, there's a lot of life
Right.
left to live. I
Exactly.
think that's a message that women don't always hear, but it's very important that you share that there's a lot of time left, right?
Yes, if you're 40 or 50, even 60, like there is still a lot of life left. And on the other hand, it's not guaranteed,
Yeah.
right? So if you people who think, oh, I am going to work really hard, I'm going to persevere, I'm going to do this until I can retire at 68 or whatever, it's not guaranteed that your health is going to be in good shape at that point. You may need to be a caregiver for one of your parents at that point. And so you're thinking, oh, I'm going to finally be able to pivot or vacation or whatever it is. And that's not guaranteed.
Yeah.
So I guess that was another consideration that I had as I was thinking about my career pivot is I cannot work to burn out for my entire life thinking that, oh, at some point in the future, things will be better because that's not guaranteed. So it's better to make sure you're doing some living now, right? And not just thinking that at some mythical point in retirement, then everything is going to be better.
Absolutely. And I've stopped looking for the little old lady house now.
Right.
Catherine, thank you so much. This was really informative. I learned a lot. I'm glad I got to ask a little bit about your
Oh,
background, and I
thank
hope
you.
the attendees did as well. It was really fun. Thank you, Catherine.
You're welcome.